was inflicted with. Perhaps you're wondering why I've asked you to meet me here at the clinic at such an early hour. I believe it is of utmost importance that we view this very urgently and very precisely, so that I may understand, study, treat, and of course cure this affliction that you found yourself with. Of course, it was your family who contacted me with concerns regarding your tingle immunity. Of course, when it comes to immunity, this is a very positive thing. Being vaccinated or receiving immunity post-infection can sometimes be very, very helpful to protect ourselves and our bodies. However, it has come to light that you've become immune to tingles from ASMR. This is not good. You may ask yourself why I'm whispering, and the importance of continual exposure to you now while we are in the clinic is very important. It is of utmost importance that I continue to express whatever possible triggers I can to you while we attempt to elicit the issue and, of course, bring it to light and treat it. I will need to take a sample for biopsy to send off. This will be in the form of a swab, and so do not worry, it is well tolerated and should cause you no harm. I will, of course, inoculate you with the treatment today, which will render you cured from tingle immunity, and you will, of course, find yourself very, very comfortable and relaxed. I feel we're running out of time. Let us begin. While I prepare myself here, I must ask you some questions. Of course, the history is very important. I'm going to ready to the treatment. I wonder, how long have you been in tingle immunity? I see. 2 weeks. I'm sorry to hear that. 2 weeks is far too long to be without tingles. And now tell me, have you noticed any associated symptoms, for example, a fever? No? Very good. Any respiratory compromise, such as cough, shortness of breath? Wonderful. Yes, well, it is relevant in very rare cases. This is something that can progress, causing dramatic complications. Have you noticed any pain anywhere? Wonderful. And you're sleeping well? No. I see. I pray that we've caught this early enough to render it inactive. Tell me about your past history. Right, and do you regularly consume ASMR content on YouTube? You do? Good. And do you utilize this for sleep or for relaxation? Both. Good, good. Any recent stresses in your life recently? very few side effects. But the most important one is that it will render you susceptible to ASMR triggers once more. It will be administered as a simple injection. Yes, of course, this is very necessary. Yes, the tapping is absolutely necessary, and in times such as these, we cannot skip a step. Do you use any regular medications? And do you have any allergies? Very well. Do you have the ability to rest for the next several days? Brilliant. While it is not mandatory, it certainly will help the treatment take hold. Yes, of course, life is short, as you know. We must take the time to enjoy ourselves while we can. Certainly, approaching this treatment from a gratitude perspective will be very helpful. Alright, now we must prepare to take a sample. This, of course, is how we the sample, I need to elucidate the actual cause of your immunity. And so you may not have noticed, but the triggers that I'm bringing to you now are intended to bring forward the pathogen and ultimate cause of your tingle immunity. While we prepare to take a sample, I think we've brought it out. Do you feel that? You see, it does require patience. But we're nearly ready to take a sample now. Let us prepare. is incredibly delicate. This material will preserve the active sample of the pathogen that is causing your tingle immunity, and we will send this off to our microbiology lab for processing, for culturing, and to review its sensitivity to the treatments that we have available to us. I would like to take the sample now. I must pay careful attention to go to the right location. Okay, I'm going to take the sample now. Be ready. Very good. You tolerated that procedure quite well. The sample has been received. It will now go urgently to the lab for processing. You've done very well with this. How do you feel? Wonderful. Yes, I understand that this can be quite an alarming procedure, and certainly a lot can go wrong. But you've managed this very well, and I'm glad that you came when you did. When you present yourself urgently, such as this, we have time and opportunity. I will now prepare the treatment for administration. As I mentioned, this procedure is tolerated very well, with very few side effects or complications. You may notice that the tingles that you experience are more extreme over the next 72 hours. Do not be alarmed. This is a normal finding. What we have here is 1.5 cc's of the tingle immunoglobulin, which will be administered now. It is manufactured with an adjuvant that can strongly promote ASMR tingles. This is a highly regulated and controlled substance, however it is very safe, and we will administer it now to you to ensure that your tingles return. Once again, I'm very relieved that you did present when you did. Severe cases of tingle immunity are not unheard of these days, unfortunately. It requires prompt medical management. Let us begin. Alright, I'm going to administer the treatment now. This material will be injected into your skin. It will be absorbed into your body, and you will feel tingles return. Let us begin. You've done quite well. I'm impressed. The tingle immunity cure has been provided to you. I will continue to follow up with you in our urgent outpatient clinic. I would like to see you back here tomorrow for a reassessment, and I would encourage you to explore new ASMR channels, but also return to the ones that you've come to love. Have a wonderful day. Thank you for presenting here today.